Hello, welcome to week 22 of your pregnancy. At this point, the top of your uterus, also known as your fundus, is about an inch or 2 centimeters above your belly button. Within that uterus, your tiny human is now measuring about 11.5 to 12 inches or 29 centimeters from head to toe and weighs close to a pound or 480 grams. The good news is you are at the very edge of what's called viability. That means if your baby were to be born this week and you have access to excellent neonatal care, he or she actually has about a 36% chance of surviving outside of your uterus. This week your baby is practicing grasping. He or she can hear your heartbeat, and if your tummy is rumbling, they hear that too. Even though your baby's eyelids are still fused, he or she can perceive light and dark. The baby's heart is beating 120 to 160 times per minute. Are you a fur mama? Your pets do detect your pregnancy. They may be more protective, they may be more clingy than they usually are. So what's normal? It is normal for you to have cramps, twinges, those round ligament pains. You are probably feeling a fair amount of fetal movement at this point. If you are not feeling fetal movement, it is okay. You will soon. It's very normal for you to have heartburn. Make sure that you're eating small, frequent meals throughout the day. Milk products do help. If none of that works, ask your OB for pregnancy-friendly medications that are available over the counter. You may be having swelling, especially if you are on your feet all day. Elevate those feet at the end of the day. Try adding a little bit of lemon to your water to help your body get rid of that extra fluid. You may be having constipation, which unfortunately can lead to hemorrhoids. Again, make sure you're drinking plenty of fluids and adding some high-fiber foods to your diet. The good news is your hair and nails are growing faster and are stronger than they are when you're not pregnant. The bad news is if you color your hair, that coloring won't last for very long because your hair is growing out quicker. What's not okay at this point? Bright red bleeding that's enough to saturate a pad, cramping that won't go away, severe pain of any kind that is persistent. If you have any of those issues, please contact your OB. So if you have a visit coming up this week, you can anticipate they're going to want to get your vital signs. They're going to want to get your weight. Normal weight gain at this point is anywhere from 0.5 pound to 1 pound a week. They're probably going to want to measure your tummy. They measure with a tape measure from the top of your pubic bone to the top of your uterus in centimeters. Those centimeters should match your weeks, plus or minus 2. They may want to listen to the baby's heartbeat with a Doppler that looks like this. So what are some things you can be doing? I encourage you to stay well hydrated, eat a healthy diet, take a prenatal vitamin, exercise, get plenty of rest. Make sure you're keeping a list of questions to ask at your next visit with your OB provider. Are there any questions I can answer for you today? Please drop them in the comment section below. While you're down there, go ahead and hit that like button. If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CeeJay. I'm at your cervix.